In the early 1600s, the world was larger than imagination.
From the bustling ports of Lisbon to the hidden courtyards of Beijing, knowledge traveled in fragile whispers.
Among those who carried it was a Jesuit missionary from Poland, Michał Boym. Boym was no ordinary priest.
He was a diplomat, a scientist, and an adventurer who braved storms, disease, and political intrigue to bring China's medical wisdom to Europe. And in his hands, he carried a book, key, that would unlock a new vision of the human body. 17th century Europe was still bound by the ancient theory of the four humors: blood, phlegm, yellow bile, and black bile. Doctors judged illness by the color of urine or the feel of a patient's skin. Meanwhile, in China, physicians used a different map of the body. They read the pulse not just to count beats, but to sense the flow of life itself. Boym arrived in this world as a student of both faith and science. He listened to Chinese doctors, observed their clinics, and learned the delicate art of placing 3 fingers on the wrist to feel the rhythms within.
What he saw challenged the medical doctrines he had been taught in Europe.
Years later, in 1686, Boym's work would finally reach print in Europe. Titled Clavis Medica ad Chinarum Doctrinam de Pulsibus, the medical key to the Chinese doctrine of pulses. It was published in Latin by the physician and editor Andreas Clare in Nuremberg. The book was more than a translation. It contained detailed illustrations of pulse-taking, charts of the human body, according to Chinese medicine, and Boym's own reflections. Through its pages, European scholars
encountered a medical philosophy that treated the body as a living network of flows, cycles, and balances.
For European medicine, these concepts were revolutionary.
They suggested that a physician should listen to the body's rhythms, not just dissect its parts. Boym's medical key did not transform European medicine overnight, but it planted seeds. Seeds that would grow into a new respect for observation,
empirical testing, and the patient's own experience. His work bridged continents, not just in maps and trade, but in the understanding of life itself. Today, we see his book as a symbol of dialogue, a reminder that wisdom travels best when carried with humility, curiosity, and an open mind.